Hello, my name is Dr. Folashade Adelekan. I'm a consultant clinical hematologist, which is basically a specialist in blood disorders. I've lived in Lagos for the past 11 years. So the process of apheresis basically describes separation of blood products, taking out what you need or taking out harmful things that you need to discard from a patient. I have been able to make a difference. During my residency training program in Lagos University Teaching Hospital, 2014, I remember having a patient, a young chap, 17-year-old. He came in bleeding from different orifices in his head. We got to know that the boy had an acute leukemia. So in his case, the reason why he was bleeding was because he had a very low platelet count. Normal platelet count is between 100 to 400 per microliter in our bodies. I think his count was 8. At that time, there was only one machine in Luth that was functioning for that. It could spin, I think, 4 platelets at a time, and it could work maybe twice a day. If you were able to get one bag, you would rejoice. But one bag wouldn't do anything. He was on the ward for 6 good weeks before he finally bled out, and died. It was quite clear to me that anybody that came with an acute leukemia was going to die. And at that point, also being that I was in residency training, we were already reading about different technologies by which we could produce platelets. And the other way was apheresis. So when I saw that this technology was what we needed, I just knew that whether I had to beg, borrow, steal, whatever, I had to get that machine. And we had to be able to use it to save the lives of patients. Being the kind of person that I am, nothing really phases me. If it's something that needs to be done and I can do it, I just go ahead and do it. I don't really need to see anybody do it.